Hello everyone, good to see you all with another video. Today we're going to see about hydrocarbon poisoning. Hydrocarbon, there are multiple different types of hydrocarbon which can be poisonous to humans. So, hydrocarbon can be poisonous and also have injurious effects in the human body as well. So, what type of injurious effects and poisonings that hydrocarbon do is what we are going to see in this video today. So, if someone has ingested hydrocarbons and it can go in the gastrointestinal tract. Once it enters into the gastrointestinal tract, it can have local effect. That local effect means if it can cause irritation of the gastric mucosa. Like if you take kerosene and gasoline, can definitely cause damage to the mucosa and cause erosions. The other thing is aspiration. If you see what kind of an aspiration it can do, once the patient has ingested the hydrocarbon, the patient might have gagging or cough because of the effect of the hydrocarbon in the pharynx, so nasopharynx. So it itself can cause aspiration. That means the entering of these hydrocarbons into the respiratory system. The other thing is patient might attempt to vomit after the ingestion. So this also can lead to entering of hydrocarbon into the respiratory system. So the hydrocarbon which has entered into the gastrointestinal system can again enter back into the respiratory system. So if we can see the propensity to cause pneumonitis, that means once the hydrocarbon has entered the respiratory system, that will cause inflammatory effect in the respiratory system, which will cause to pneumonitis, the condition called pneumonitis. So the propensity, that means the tendency to cause this pneumonitis, depends on the physical characteristics and chemical characteristics of this hydrocarbon. So if the hydrocarbon has high volatility, it can enter the respiratory system, aromatize and enter the respiratory system easily. So that has the high chances of causing pneumonitis. And the other thing is viscosity. If a high viscosity particle has low chance of aromatizing or entering into the respiratory system. So low viscosity, high volatility. What are the hydrocarbons? Spirits, kerosenes, gasolines. These are the most known uh, hydrocarbons which has low viscosity and high volatility. These can enter into the respiratory system and cause pneumonitis very easily. So if you look up, less than 1 ml of these hydrocarbons can cause a significant lung damage. So less than 1 ml enters into the lungs, it can cause a significant damage to the cells. So what it will do is it will cause damage to the type 1 and type 2 cells. So type 2 cells are responsible for synthesis of surfactant. So surfactant synthesis will be abrupted. And the other thing, the epithelium which are responsible for transport of oxygen will be also affected. So that will cause, both will cause respiratory distress syndrome. So you can see the respiratory distress syndrome because of pneumonitis. You can see the clinical, the characteristical features of pneumonitis in the X-ray, which will appear technically after 6 hours of ingestion. And you can see because of pneumonitis, this is a inflammatory process. Leukocytosis can be seen in the full blood count. That certainly not need to be because of a bacterial infection. And pneumococele can be observed in 2 to 3 weeks as a complication. The other effect can be systemic. So once it has entered in the gastrointestinal tract and absorbed, it's going into the systemic circulation and entering into multiple organs. So there are different types of hydrocarbons which can cause different types of systemic toxicity in the human body. So it can enter into multiple different organs, and different type of hydrocarbons can cause different kind of organ failure. So we can see carbon tetrachloride here, which is having hepatotoxicity. Benzene having can cause cancer. Nitrobenzene and alanine can cause methemoglobinemia. Volatile hydrocarbons such as uh, toluene can cause type 4 renal tubular acidosis, and other halogenated hydrocarbons can cause cardiac effects like dysarrhythmia, and they can cause sudden sniffing jets. So, how we treat these uh, hydrocarbon toxicity? Emesis and lavage really contradict. You should not do. So once you do the lavage and have emesis, again it can enter into the respiratory system, causing pneumonitis, and again however causing pneumonitis, it will again enter into the systemic toxicity. So we are not treating the patient, we are complicating the patient. Activated charcoal, no use. That will not bind to these hydrocarbons. So inducing vomiting, again useless. And no antibiotic or hydrocortisone is beneficial as well. So what we can do, if the patient is having respiratory failure, we can keep supportive treatment with ventilator and ECMO. And we can treat the each of these uh, effects. Right? The patient is developed hepatotoxicity, we have to treat the acute liver injury. We have to give NAC, and further treating the like hepatitis or liver failure, we have to treat according to that. And cancer, again, like whatever cancer that benzene has caused, we have to treat that. And the complication, which are caused by this hydrocarbon, need to be treated. The patient is developing dysarrhythmia, we can use beta blockers. Volatile hydrocarbons are prone to cause dysarrhythmia. So if the patient with hydrocarbon injection having dysarrhythmia, we can treat with beta blockers. The important points on hydrocarbon treatment we have to remember is we cannot give lavage, we cannot give activated charcoal. We have to treat the complication which are causing respiratory failure, ventilator support, cardiac problems, heart failure. We have to treat the heart failure. Dysarrhythmia, we have to give beta blockers. Renal failure, we have to treat like AKI. If it is into causing CKD, we have to treat a CKD. For renal tubular acidosis, we have to treat accordingly. And hepatitis, we have to treat uh, accordingly. And that's how the treatment is going to be for hydrocarbon poisoning. Thank you, and we will meet you in another video.